Hi, I'm Richard Karn, and you may have seen me on TV talking about the world's #1 expandable garden hose. Well, the brand new Pocket Hose Copperhead with Pocket Pivot is here, and it's a total game changer. Old-fashioned hoses get kinks and creases at the spigot, but the Copperhead's Pocket Pivot swivels 360 degrees for full water flow and freedom to water with ease all around your home. When you're all done, this rust-proof anti-burst hose shrinks back down to pocket size for effortless handling and tidy storage. Plus, your super light and ultra-durable Pocket Hose Copperhead is backed with a 10-year warranty. What could be better than that? I'll tell you what, an exciting radio-exclusive offer just for you. For a limited time, you can get a free Pocket Pivot and their 10-pattern sprayer with the purchase of any size Copperhead hose. Just text WATER to 64,000. That's WATER to 64,000 for your 2 free gifts with purchase. WATER to 64,000.
By texting 64,000, you agree to receive recurring automated marketing messages from Pocket Hose. Message and data rates may apply. No purchase required. Terms apply. Available at pockethose.com/terms.
Welcome to Coruzant Technologies, home of the Digital Executive Podcast.
Welcome to the Digital Executive. Today's guest is Jim Szyperski. Jim Szyperski is a seasoned entrepreneur with over 30 years of experience leading technology companies across industries, including mental health care, education, energy, financial services, and telecommunications. He has a proven track record of driving innovation, building high-performing teams, and guiding companies from early growth to successful outcomes. As co-founder and CEO of Acuity Behavioral Health, Jim is focused on transforming how mental health care is delivered and measured. Over the past decade, he has developed technology solutions that improve access, quality, and outcomes in behavioral health. Prior to Acuity, Jim held executive roles at Prome Behavioral Health, Power Generation Services, and Webtone Technologies, amongst others. He has also served on the boards and advisory councils of several technology companies and nonprofits, offering expertise in strategy, scaling, and product development. Well, good afternoon, Jim. Welcome to the show.
Brian, thank you. Glad to be here.
Absolutely. I appreciate it, my friend. I know you're hailing out of Atlanta, Georgia. I'm in Kansas City early this morning. So let's just jump into your first question here. I want to talk a little bit about kind of your background and what you do now at Acuity. So you've led companies across diverse industries. What drew you specifically to focus on mental health care with Acuity Behavioral Health?
You know, that's interesting. I think like a lot of people, Brian, it became personal probably 10 plus years ago. I had family members who had suffered, and some severely, from mental illness. And I've been in the tech business all my life. So I had an opportunity to get into mental health technology, speaking to a VC friend at some point. And I said, well, that sounds interesting. And how hard can it be? It's very hard. But so I got into it that way. It's personal reasons, like a lot of people do. I think probably the last 5 years, we've seen all kinds of people impacted. But this has been a problem that's been going on for a long time.
Thank you for sharing. And generally, when we start the podcast, there's always some sort of story that led you to where you are, or a problem someone was trying to solve. And I appreciate that. I think we've all been touched by family members and friends that have been impacted by challenges within the mental health arena. So I appreciate your story. Jim, what are some of the biggest challenges in the current behavioral health system, and how is Acuity aiming to solve them with technology?
That's a great question. And it's kind of a two-part. One, there's kind of the general behavioral health field. And I'll speak to it probably more specifically to the work we do, which is largely in the inpatient psychiatric, at least starting at inpatient psychiatric field. But there are more patients showing up than ever. And that's been an escalating trend probably for the last 20 years, but really has spiked since the pandemic and even continues today. So more patients, more people are showing up at emergency rooms, at clinics that are suffering from mental illness. And not only more people showing up, but their symptoms are more severe than they used to be. So if you think of that in context of a hospital, for instance, that requires generally a higher level of care and treatment and probably a longer length of stay. And those things are occurring at the same time. We have kind of well-publicized nurse shortages. So staffing's a real issue. There's a shortage of beds, inpatient beds across the country. Normally, most hospitals are well above capacity on that. So they're trying to find places to put people. So you've got too many people, you're basically oversubscribed, you're understaffed, and probably as importantly, you're underfunded. It's got a horrible reimbursement model currently. So most hospitals maybe recover 65, 70% of the costs. So it's not like there's additional money coming in that can help offset these kind of increases in patient volume. So it's a real problem. And part of what drives that is unlike the rest of healthcare, mental health care lacks models and kind of standards that everyone adopts and uses. So everyone does it differently. And that makes it very, very difficult to collect data, as you can imagine. Look at that data, analyze that data, come up with best practices, develop best practices, publicize those best practices. So it's kind of all over the place. And that's a real problem because anytime there's that high degree of variation, there's a high degree of cost. I tend to think of it as in kind of a downward spiral. And what we're doing at Acuity is we provide clinical operating models for inpatient psychiatry to kind of help nurse staffing, nurse managers, administrators better manage the nurses and staff that they have and the bed utilization and what they have. So essentially, in a nutshell, try to get the right person to the right patient at the right time and make their operations more efficient and provide a model that they can then turn around and talk to payers about.
Thank you. I appreciate that. And it certainly is challenging all across the healthcare spectrum. I'm actually a technologist that's been in healthcare 20 plus years, so I get it. But mental health, inpatient behavioral health, absolutely shortage of clinicians, nurses, inpatient beds. We get it. So I appreciate what you're doing, leveraging some technology in there and, improving these clinical operating models to make it a better place for our patients and our staff. So Jim, with growing attention on mental health in the workplace, how can employers and digital platforms better collaborate to support employee well-being?
Probably a couple of answers to that. One, I think the adoption of act like the rest of healthcare, where models and standards and data collection and data aggregation and analysis of that has been done for decades. I always use the first open heart surgery, probably had a very, very low survival rate, below 10%, and now it's 95 plus. And that's because people learned from it. They collected data, they saw what happened, it became actionable. Best practices evolved from that. The same things need to happen in behavioral health care. It needs to be far less subjective and qualitative. And although there will always be that component of it and it needs to be much more quantitative in terms of, so people adopting the same standards, adopting models and kind of building on that. And I think until that happens, it's going to be a real problem. Now for employers, I think everyone just, understand. I think people do more so now than they did 5 years ago. Mental health care is healthcare. So when you provide resources to your employees, or whether it's hospital staff or whether it's just a general employment environment, provide the resources, provide the support, make sure you're checking on your people. Just like if someone broke their leg and was gone for a couple of days, people wouldn't think much about that. If someone has a mental health crisis and needs to be gone for a couple of days, people still are less accepting of that, and it's just wrong. So I think it's kind of getting standards, getting models in place, and supporting that, and realizing that your best employees are the ones that you take the best care of.
I appreciate that. It is so important to implement good standards and models. And of course, to get there, sometimes it could be a process improvement process, could be technology, but at the end of the day, collecting and providing actionable data is key to making these data-driven decisions for improved care. So I appreciate your insights on that. And Jim, the last question of the day I have for you, what trends are you seeing in digital mental health innovation, and where do you think the industry is headed in the next 5 years?
Hi, I'm Richard Karn, and you may have seen me on TV talking about the world's #1 expandable garden hose. Well, the brand new Pocket Hose Copperhead with Pocket Pivot is here, and it's a total game changer. Old-fashioned hoses get kinks and creases at the spigot, but the Copperhead's Pocket Pivot swivels 360 degrees for full water flow and freedom to water with ease all around your home. When you're all done, this rust-proof anti-burst hose shrinks back down to pocket size for effortless handling and tidy storage. Plus, your super light and ultra-durable Pocket Hose Copperhead is backed with a 10-year warranty. What could be better than that? I'll tell you what, an exciting radio-exclusive offer just for you. For a limited time, you can get a free Pocket Pivot and their 10-pattern sprayer with the purchase of any size Copperhead hose. Just text WATER to 64,000. That's WATER to 64,000 for your 2 free gifts with purchase. WATER to 64,000.
By texting 64,000, you agree to receive recurring automated marketing messages from Pocket Hose. Message and data rates may apply. No purchase required. Terms apply. Available at pockethose.com/terms.
I think it is still an area that's ripe for innovation. If you look at mental health, there's a spectrum of low acuity issues. I've got a mild case of depression or anxiety, which most of us have had for the last 5 years, 10 years. And then there's this more severe scale. So I think a great deal has been done to try to come up with ways, whether it's through meditation apps, whether it's through just instructional apps, things you could have on your phone that if I have a mild case of depression or anxiety might be helpful to me. When you get to the larger end of it, I think that's the area in the more severe side of it. That's where it's still very much lacking. So I think where the real opportunities are leveraging data. I mean, certainly there's some great things that have been done with generative AI in terms of taking notes and documenting clinicians' work and taking the time-consuming tasks away from them. I still think there's a great place for doing that. I think the propagation of more screening technologies using AI, so I can ferret out or triage better on the front end. And I try to identify things early that doesn't necessarily require a human to do at the point of engagement. So can I triage better with that and then get people to the right place based on their diagnosis? So I think technology plays a massive role in that. There's never, in my lifetime, there won't be enough clinicians, psychiatrists, nurses, staff to deal with this problem. So that's where I think technology can play a good role in supporting that and informing that. I don't think it's a decisioning technology yet in clinical environments. My opinion on that may change over the next 5 years, but I don't know that it will. I think there are a lot of things that technology can do to support the people who are already there and kind of fill in the gaps where they are taking time that maybe could be better done by something that's automated. Does that make sense?
Absolutely. I love that. Just like healthcare, which I was in for many years, mental health is definitely ripe for innovation. Healthcare still lags behind in some areas. But, using technology to better triage, like you said, new screening methods, leveraging generative AI, technology can certainly help fill the gaps, with hard to keep clinicians, maybe improve that timeline from admitting to a bed, that sort of thing. And absolutely, we're going to have to get more creative with our processes, but also the technology that is now here. And it's certainly advanced quite quickly in the last couple of years with AI. So thank you. Jim, it was certainly a pleasure having you on today, and I look forward to speaking with you real soon.
Right. I appreciate it. Thank you for having us.
Bye for now.
On WhatsApp, no one can see or hear your personal messages, whether it's a voice call, message, or sending a password. To WhatsApp, it's all just this. So whether you're sharing the streaming password in the family chat or trading those late-night voice messages that could basically become a podcast, your personal messages stay between you, your friends, and your family. No one else, not even us. WhatsApp, message privately.